review for us what are the changes in the age procedures?
The change is that pediatric trauma patients, which conventionally goes to age 16, what we're asking to do is to expand the age capacity to go to just under 18 years, 17 years and 364 days, so to increase by 2 years the capacity.
What will that do in terms of patient load, assisting the community and so on?
Well, to increase the patient load, obviously, the number of patients, that when you increase the age like that, you'll see more patients, obviously, who fall into that age window, between 16 and 18, who now will be able to receive trauma care in our center.
What led to this decision?
Well, this has been part of an ongoing discussion and consideration really over the last several years. I took part in a town hall meeting about this issue a number of years ago, and part of the issue is to just try to understand how we can expand access. That's been a number of the initiatives that we've been working on here, not just around trauma, but around all kinds of adult and pediatric care. It's been focused on expanding access, things like emergency care, and even some of the specialty care that we do. So this is really an extension of that work, and to say, how can we expand services to meet the needs of the community?
How many more patients do you expect to have to serve as a result of this decision, and when does it take effect?
Well, as to the number of patients that'll be affected, it's a little bit uncertain, right? Because we don't know what the trends will be in terms of the needs for trauma care as we go forward in time. But it'll probably be on the order of 100 or 100 more patients each year who might be coming through.
And how will the hospital plan on taking care of them, and when does it take effect?
Well, we need to expand some of the services, some of the capacity we have. One of the advantages of approaching it in this manner, of expanding our pediatric trauma services, is a recognition that we already have the base of trauma services in place. We already have been a level 1 pediatric trauma center for a long time. And so some of that core expertise and core resources are already in place. And so building on that is a little bit easier to do than to start afresh with any kind of new program. As far as the timing for how this unfolds, some of that will have to do with working with the state and with the other trauma partners in terms of when we can change the protocols for emergency medical services, Chicago Fire Department. So that's going to be discussions that we've already entered into with our discussions with IDPH over the last bit of time.
What's the projected cost for this expansion?
I'm not sure that we have a specific dollar amount about what it will cost to actually do this. It's a service that we need to provide, and so how that will change will depend largely on just how many patients are coming through and just what additional resources we need to add. But it's a commitment that we're making now, even as we still pursue and try to understand the costs.
Can you outline even generally the resource changes that would be needed? Are you talking about more square footage, more instruments, more doctors? What would you need?
It's a good question. It's less around a square footage issue and more around some of the equipment and the expertise that we need to provide additional coverage and additional capacity. So in a world where you might be ready to receive, and this is just as a hypothetical, one patient coming in the situation of a trauma event, now you might see 2 or 3 patients, or magnified up from then, so already we receive multiple traumas with some frequency. So it's a capacity in the moment to take care of multiple patients rather than a new building or a new facility per se.
Do you know how many additional staff you'll need to bring on, or do you have a ballpark idea?
I think we're still trying to understand exactly what those numbers will look like. It's something that we've looked at internally, but again, we need to really understand and work with some of the other trauma providers to just see what that'll look like in terms of the sheer
Are there
numbers.
conversations about expanding the age even further beyond 17 years old and eventually opening an adult trauma center the way that that community is requesting and is having pushing for?
So it's sort of 2 questions about expanding the age even further. I mean, this is a step forward in terms of expanding the age this far. And again, for the most part, while some pediatric centers take care of older patients, in terms of trauma, this will be relatively new in Illinois, to expand it to the age of 18. As far as the adult trauma, it's really obviously a related question, but a separate undertaking, because that would be a circumstance of starting entirely from scratch in terms of resources and expertise. Again, we're blessed to have a lot of resources and have a lot of expertise, but the unique nature of trauma really demands that you are growing very specific programs, very specific capabilities, and the blend between pediatrics and adults is not an entirely seamless one. And our pediatric colleagues will always remind us that kids aren't just little adults when you're taking care of them, but similarly, adults who need trauma care, other care, aren't just big kids. And we need to look at the entire spectrum of not only the trauma care we're providing, the emergency care, but really everything that happens here in a children's hospital to make sure we're meeting the needs of all of our patients.
But earlier you said that there were ongoing conversations about the expansion of age. Are there conversations taking place about providing trauma care for adults here?
I think the conversations are really in listening, trying to understand the perspective of folks in the community, and importantly, discussions not just here, but discussions with other trauma providers in the city. So yes, we've been undertaking those discussions for some time with, again, the experts at other centers in the city, experts in emergency medical services and the fire department, to truly try to understand what the needs are and how those needs can be met by an entire trauma system, and rather than just looking at one institution.
What state approvals are needed for this 2-year expansion? What are the chances of getting it?
Well, we think we can be really optimistic about getting the expansion. Again, there's been a pretty clear case that's been asserted within the community in trying to expand access, and with us endorsing and saying we think that's something that we really want to provide and conserve. I'd be disappointed to see someone at the state level say that that wouldn't be a good idea. As far as the timing of it and the process for it, a little bit is still unfolding because we don't know exactly the precedent by which that'll be followed. But we're confident that working with Dr. Hasbrook and the IDPH, that there's going to be a lot of energy and attention given to this, so we really don't expect it to be a long delay. That said, we do want to make sure our resources are ready or in place, but we're undertaking that work with the announcements today, and I think that we're optimistic that as soon as we can get this up and running, we'll have the approval from the state and move forward.